Hey guys, I want to do a quick just recording for you guys to talk about this PICO question assignment. I know like the first draft was due yesterday, and I apologize. I was sick all week last week, so I got behind on everything. And so I'm just now getting the assignment put up. So if you guys, since there's only a few of you, want to turn in your PICO questions by Friday, for me to kind of look over, and then I'll get them back to you and you can turn your final one in by next Monday. And I'll change that on Blackboard to on the assignment so it won't show that it's late. So I'll have your assignment due Monday. So if you want to send them to me by Friday at 11:59, then I will look at them Friday and or how about let's get them by Thursday, 11:59. That way I'll have Friday to look at them. It won't take me very long to look over them and make, if you need any corrections or kind of to reword things, I can tell you that, and then you can turn them back in Monday. So Thursday, and I'll put an announcement that says this too. And then on Monday, the final will be due because it's my fault I didn't get this up. So anyway, I just want to talk to you a little bit about the PICO question. Assignment. In your actual assignment, there are a few questions that you answer at first about where you currently work as a nurse, or maybe something you saw in clinical rotations or something. But I want you to really think about those things when you're writing these questions and come up with some kind of issue or something that you've seen in clinical practice that you really would like to have answered. That maybe at your facility, they may not be using evidence-based practice for this. So what do you want to know? So your PICO format, and we've talked about this before, the P stands for patient population, I is for intervention, C is for comparison, O is for outcome, and T is for the time it takes. So this is similar to what you have as your assignment. I will post this kind of descriptive thing under your week 7 as well, so that you can look at these definitions because they kind of help. But I want each of you individually to write these 5 different questions. So an intervention question, so that's something where you actually implement some kind of treatment and looking for the best outcome. And this is what you'll take one of you guys' intervention question, you'll decide as a group, and continue on with your group project. So make sure this is something that you really want to know about. Etiology questions are things that cause some kind of condition. A diagnosis or diagnostic test question is actually, it needs to be some kind of diagnostic test. So some of them that I've had, like in my face-to-face class, were in elderly males with prostate cancer is a digital rectal exam compared with a PSA test, more accurate in diagnosing cancer. Something like that. So it's actually some kind of diagnosis or diagnostic test. A prognosis or prediction question is looking at, what's going to happen or what might be complications of a condition. So looking kind of into the future, what's the outcome going to be. And then a meaning is just to understand the meaning. And this is a little more like a descriptive type research, or it could be more qualitative. So the meaning one's a little bit softer. What we found when we were working on these in class is that your etiology and your prognosis questions, if you have a really good one, and I'll be sure when I read yours to tell you if, hey, this is a super good question, I really like this, I think it'd be interesting. You can reword those sometimes just a little bit and turn those into an intervention or therapy question. And so that might be something that you do as your group, decide on somebody's prognosis question and kind of rework it into an intervention question and use that for your group project. So I just wanted to make sure you knew that was an option for you. So I'm going to post this, but there's short definitions, and then here's some sample questions. So be sure and look at these. This will give you kind of some ideas, but also think about practicality too. Like I had someone, I think for a diagnosis question, wrote, in hospitalized patients is like intravenous blood pressure monitoring compared to manual monitoring with a sphygmomanometer more accurate. And so when I'm talking to her about that, I was like, okay, the problem is not every hospitalized patient's going to have intravenous monitoring, like arterial monitoring. So you probably need to change your population or change what you're comparing, because that's not a really good question. You're not going to have enough people when you're just looking at hospitalized patients to do that study and figure that out. So make sure it's something that's practical. So, like I said, there's these sample questions. I will post this entire sheet for you to use and look at. But I wanted to show you one more thing here. Let me move my screen over a little bit. Okay, so under week 7, your PICOT question, and I did go in and fix Blackboard. There was some things that got moved around some way, and I'm not sure what happened. I'm working in 3 courses at once, so I'm sure it was my fault and I did something weird, but it should be fixed now. And I thank you, Phyllis, for asking about that and for bringing that to my attention, because I have it fixed, I think. If anybody else notices anything that's kind of in a weird place, please let me know, because I want it to be right. So don't hesitate to ask questions. And I'm, for some reason, horrible at checking the discussion board questions if you post them there. So please email me or text me, because I'll get right back to you on those. I don't know, the discussion board slips my mind sometimes. So, but there's this EBP project sign up, and I need you to sign up by the end of the week this week for this EBP project. And so I wanted to show you, it's super easy to do. You just click on it, and it takes you to the wiki site, and you click on the EBP group project sign up. And then, you can't see this, I need to expand my screen a little bit or move it over. Over here, under my video recording, you can't see, it says edit wiki content. If you just click on that, then it will pull up, I'm having to move my screen back more so I don't have it big enough, but it'll pull up the wiki page, and you'll simply go in and type your name wherever you want it to be. So I think there's 7 of you guys, so you'll have one group of 4 and one group of 3. And what I would prefer is like the group of 3 that no one sign up for the 14-15 week, and that could be just kind of a collaborative week. So that's actually your presentation week, and so you guys can work together on that one. But to sign up for the other weeks, for a week, somebody sign up for week 8 and 9, somebody for 10 and 11, and somebody for 12 and 13. And then the one that has 4, the 4th person can be in charge of, you know, getting your presentation submitted and making sure everything's good on that. But anyway, you just type your name in, and then over on the right-hand side, which you can't see because I don't have my screen big enough, but over on the far right-hand side, there's a submit button, and when you submit, it puts your name in there. And so anytime you go look at this, you can see live what everyone's done, and it keeps it all in one place. And so when everyone's done signing up, I'll just copy and paste this and put an announcement so that we all are aware. But like I said, you can go back in and edit. Like if you sign up and then you talk to your friend and they're like, oh, I'd rather do this week, and you say, oh, well, okay, I'll do that week. Then you can go in and edit it and change as many times as you want. So this is like a live document we can all work in at the same time. So just click submit, and it will save your changes. And then, like I said, you can go back into it in any time and edit it. So be sure you know that. But just have it all done by the 24th at midnight. All right. So as a reminder, PICOT questions, if you'll get those to me by Thursday, which is the 23rd, and just your initial draft, you can email it to me. I will comment on it and send it back to you so that you should have a good one to upload for your actual assignment. And then I'm also this afternoon going to try to get all of the compare and contrast tables graded. I apologize for being late on those too. Like I said, that crud or whatever was going around hit me hard last week, so I was down for the count. But I'm going to get those caught up today, hopefully, and get all the grades caught up so you'll know where you're at grade-wise in this class up to this point. So we've just got a couple of more chapters, I think, before I put like your homework grade in. But as soon as those are finished, I'll get those homework grades put in where you've completed all your homework in the point. And so you should have a really accurate representation of where you're at as you're going into this group project, which is 50% of your grade. So that'll be the big chunk. Anyway, if you guys have any questions, as always, please feel free to let me know. See you soon.